So we've talked about the criteria that you have to meet for the speaking section of the OET. But now let's look at some actual speaking skills that you should be practicing. Now, I've chosen 6 different skills here, and that's mostly because as I have trained people for the OET, these are the ones I've noticed people tend to struggle with, especially incorporating them into a real life role play. So I think it's easy for these to talk about them, to learn about them, but actually to do them in a role play is quite challenging. A couple of things to note. So the OET, it is a language test, which means the assessors and the evaluators, they are looking for these language skills. So the ability to, for example, organize the conversation, or the ability to ask questions in a certain way. So what I encourage people to do is in your role play, you really want to exaggerate your ability to do these things, showing the examiner with multiple examples that you can do these different skills that they are requiring. And in this way, it sometimes might feel a little bit unnatural. It may not feel exactly like you would have a consultation with a patient. However, for the purpose of this exam, as we are testing those language skills, it is important to really show the examiner what you can do. So these 6 skills I chose are the following here. Beginning the conversation, so that's rapport development and relationship building. Question asking, starting with those open-ended questions, and then moving to a more focused or specific manner of asking those questions. Making sure that you are structured and that there's good organization. And then the emphasis here is really signposting, and we'll talk more about what that looks like. The ability to convey empathy. This has to be genuine in its expression, and I think it can be easy to memorize phrases, but actually using the phrase at the appropriate time in the right context with good intonation, conveying that very genuine sense of empathy is an important skill. The next one there is active listening. So by that, meaning that as the patient is speaking, that you are listening to what is said, you can summarize it, you can respond appropriately. So we'll talk more about that as well. And finally, accuracy with grammar and verb choices. So this goes back to the idea that your meaning should not be impacted by grammatical inaccuracy. So it should be very clear based on the question you're forming or the information you're giving, what you're trying to say. So making sure with the tenses, for example, that you have the right time frame for the question you are asking. And with verb choices, making sure it's the most appropriate verb for the context of what you are saying or asking. So we're going to look at each of these skills in detail. This is a general overview of just 6 of the skills that I recommend really spending some time focusing on. Of course, it's not limited only to these skills. There are other ones, but for our purposes, these are the ones we will focus on.